of the Anishinaabe people and express gratitude for the sharing of these lands. Time permitting, Dr. Steyn will address any questions following her presentation. Attendees are also encouraged to submit questions via chat. May I request that you mute your microphones during the presentation? This will help minimize background noise and ensure everyone listens fully to the content being presented. Thank you for your cooperation, and please join me in extending a hearty welcome to Dr. Steyn. Over to you, Dr. Steyn.
Thank you so much, Kumkum. Thank you for having me. This is my one camera just fell over. I'm quickly going to see if I can get it straight up again. Can you guys still see me?
Mm-hmm.
Okay, perfect. Let's see. There we go. Okay. Thank you so much for having me, and thank you for this very warm welcome, Kumkum. Thank you for every one of you joining me here tonight. Thank you for Burlington Libraries making this possible. This is such a pleasure, and thank you for having my book in your library. This is what the book looks like, and I'm so grateful for the very good response that I had to this book. I'm grateful for, I know many of our viewers tonight who bought this book and who helped to make this book an international bestseller. Thank you so much for that. The book was much needed. I think that's why it became an international bestseller so quick. And I'm going to share a little bit of this book with all of you. So first I want to tell, as Kumkum said, a little bit about myself. I'm a medical doctor. I work at the Oakville Hospital. I'm also a professor at McMaster University, where I teach medical students everything about hormonal health and things we'll discuss here. I have a wellness clinic. That is where I'm sitting now. That's what we were chatting about, all the plans. I enjoy coming to this wellness clinic because I feel healthier when I come here. And then I treat a lot of women with menopause. And I've had tremendous success guiding women through this pivotal phase in their lives. And I wanted to enable everyone around the world to have the same success that we have in this clinic. So it's not just a few people who can have it, but that anyone who reads this book can have it. And I started a YouTube channel, I started a podcast, everything with free resources to enable women to live their best life. It's such an important conversation to have. There are so many things that you can do to increase the quality of your life when you go through menopause. Many of us comes from cultures or families where we didn't talk about menopause as much. So it's harder. It's hard to go through this, and then women now also have a harder time when they go through menopause. It's quite interesting for a lot of my patients, when they discuss with their family, mom would say menopause was easier for her, but just in the nature of our lives, being exposed to more xenoestrogens, our hormonal load is higher. Women have a harder time going through menopause. So that is why I'm so grateful. And the amazing thing is, in this book, I've discussed things that I found in my clinic that has worked for women when they go through menopause. Things that really made, and you'll see in this book, I have a lot of case studies as I go through all the different things that helped women as they go through menopause. But now the book has been out for over 6 months, and I've had so many emails from women all over the world giving their stories, saying how implementing these strategies really made a difference in their life, increased their health, increased their quality of life. And that's my heart's desire for each one of you watching today, giving me some of your time. I appreciate your time. I hope each one of you can take something back from what I'm going to say today and implement it in your life right away so that you can have a significant better quality of life right away. So I am certified through the American Board of Lifestyle Medicine in lifestyle medicine. And what lifestyle medicine is, as I briefly want to stop here to just preface it, because that's really what the book is all about. But it's things that has science behind it, things that you can do in your life to be healthier. So we all know we have to exercise more and eat healthier. But with lifestyle medicine, we look at actual research, studies that has been done that say if you eat a certain way, if you move a certain way, if you do these things, then it can prevent cancer. You know, even as we talk about hormones, your risk of breast cancer, a lot of patients that I see in my clinic are scared of using estrogen because they don't want breast cancer. But they don't realize that drinking alcohol is a much bigger risk factor, or being at an unhealthy weight is a much bigger risk factor for breast cancer than estrogen replacement therapy. So throughout the book, I'm covering the pillars of lifestyle medicine. To quickly go through the pillars, the first pillar is nutrition. Every cell in our body is made up from what we eat. So I extensively cover nutrition in this book. Then and to really to focus on how you're nourishing your body. The next pillar of health is sleep, getting good quality sleep. And that's quite profound. Tonight I'm going to dedicate a good 10-15 minutes to sleep, because I know that's something that a lot of people struggle with, and I'll give you tips, things that you can easily implement in your life. And if you sleep better, everything is going to be better. So having good restful sleep is another pillar of health. Then rest and relaxation is a big pillar. What do you do to relax? Some people do breathing exercises, some walk in nature, some do meditation. What are the things that you do to put your body in a restful, relaxed state? A big pillar of health is to avoid toxins. Toxins are things like smoking, alcohol, drugs. And then unfortunately, we are exposed to quite a lot of toxins through pesticides, environmental toxins. You know, to really be aware, we call it xenoestrogens. These are things that wreaks havoc with your hormones, and not only for women as they go through menopause. It is also, you know, I said with every age, with men, with kids, we are exposed to so many xenoestrogens. So it's estrogen mimicking compounds that we get into our body, and then our body thinks that it's estrogen, and it blocks those estrogen receptors. That causes kids to go through through puberty quicker. It causes infertility, because it's almost as if your body is on birth control the whole time because your estrogen load is high. And then ultimately through menopause, it makes it so much harder to go through menopause. Women find that all their symptoms are significantly worse. And then if you go on a complete big detox, where make sure you're not exposed to plastics, any contaminants, pesticides, body products is important. You can have a look at the environmental EWG.org, has a list of all the products that we maybe find in North America okay to use in our products, but there might be banned for being carcinogenic in Europe. So they have a list of things, and you can look at your beauty products or use an app to scan your beauty products to make sure that you avoid toxins. That's quite important. Okay, so, and maybe Gerda, if you can put that in the chat box, ewg.org. And then as we go, please add in the chat box if you have any questions. You can also, Gerda, if you'll put our email there, it's info@wellnessmdhealth.com. Or you can look at www.wellnessmdhealth.com. We have lots of free resources on our website. There's free resources on YouTube, podcasts, everything that to help you live your best life. Okay, pillars of health. Next one would be movement. Movement looks different. Kumkum was just talking about how popular your yoga is. So for everyone, movement looks different, but it's critical to move as much as possible during menopause to maintain your muscle strength, because that's a big thing that a lot of women come to me for, is weight gain. And if we don't have good enough muscle strength, then your metabolism would slow down. If you have a bigger fat percentage than a muscle percentage, then that leads to even more weight gain. Your risk of osteoporosis is bigger. So really be doing those muscle strengthening exercises are critical. Then sure, there are so many things. Oh, social connectivity was that last pillar of health, which is so critical. Okay. Then, so those are the pillars of health, and that is really what my book is focused on. So Thrive Through Menopause is now available in the Burlington Libraries, and you can get it there. You can get it on Amazon. Everything that we're going to cover tonight, everything is available in this book. So I'm going to start off by telling you about one of my patients, Jane. I worked with Jane at the hospital. So Jane didn't start off as a patient. She just knew me. She knows that before my lifestyle medicine, I've done functional medicine. So she really knows at the hospital, everyone knows that I really work in wellness. So she came to me already a long time ago, 3 years ago. She came to me and she asked me to help her to lose weight. She was actually really a hot mess when she came to me. She wanted to, no, that's actually where things started with Jane. She wanted to have advice because she wanted to get a divorce and she wanted to quit her job. Those were the two big things. But she couldn't afford to do both of them at the same time. Yeah, that's what happened. She couldn't afford to leave her husband and to quit her job. And she just hated her job, hated her husband. She was talking to me. I just said, wait, let's just go for a walk around the hospital. We have a lovely big hospital to just chat through this. And as she was talking, her big frustration really has been she's gained 15 pounds since she started going through menopause. And I first wanted to give her advice on weight, but she didn't want any advice on nutrition because she was working with a personal trainer. She was doing everything we must do through menopause strength training. She's been on 4 different diets. She didn't want to know anything, keto, intermittent fasting. She didn't want to know anything about diet. Then as we were talking through things, I asked her, when did things start going horrible with your husband? When did things start going horrible at work? And it really coincided with the period just before menopause, as she was going through menopause. And she asked me if I can help her to balance her hormones, but without hormone therapy. She really wanted to do things natural without hormone therapy. And often when people come to me to say, let's balance my hormones, I would say, okay, let's look at your nutrition. Do you have, because hormones are made out of fat, do you have enough avocado? Do you have enough walnuts? We really look at diet. Protein, she didn't want me to look at her diet. I just had to balance her hormones without hormone therapy. So I started with sleep. So you must remember, she didn't come to me with sleep. She came to me with all these other things. But I know from experience, as soon as I fix a patient's sleep, then all the other things fall into place, and especially during menopause. Because what happens is, for men, it's easier. Men, their hormones get secreted from their testes, and that gets secreted 24/7. But women has a whole hormonal shift that happens when we're asleep at night. Our adrenals are in the day busy coping with life, cortisol, and then everything gets restored really at night when we're asleep. So that sleep period is really critical for our hormonal health. The next thing that she didn't know, that I didn't know before I learned more about menopause, was that women need more sleep than men. So, that is something to really get around, to realize that even if your spouse goes to bed late at night, most women need 8 hours of sleep. I've worked with women who actually need up to 10 hours of sleep a night. Everyone is different. So that is a very good place to start. Yes, I see you, Heather. Yes. So that's a very good place to start, is to really look at your sleep. If we go to bed late over weekends, binge watch Netflix, then you put your body in a little bit of a jet lag, and it's hard for your body. We get our most optimal sleep from 10 o'clock at night to 2 o'clock in the morning. So it's critical for you to be in bed during that time. So, and that is, I've worked with so many people who tell me they're night owls, they go to bed late, they don't have to be in bed early. But then I say, that's okay, just while you're working with me. And I only work with people if they'll work with a health coach with me as well. And then we lock their watches. We would connect their watches to our app that we use at the clinic, where their health coach can then log in and see, what time do you go to bed? Did you go into your deep sleep? How long were you in your deep sleep? How many awakenings did you have in the night? And then it's very easy to track when you have horrible brain fog or irritable mood. it usually corresponds with 2 to 3 days after you didn't have good sleep, so all of these things are so intertwined. So with Jane, we really looked at her sleep. She started making sure, and these are things that you can start implementing today right away. You can start making sure that you go every night to bed at the same time. You can do things to help you relax. So to have a very strict bedtime routine. For her, we had to treat her hot flushes. You cannot sleep if you have hot flushes that wake you up throughout the night. So hormone replacement therapy is indicated, estrogen therapy is indicated for hot flushes. That is one of the big indications. You can use estrogen. She didn't want to use estrogen. If you don't want to use estrogen, another prescription medication option that you might have is clonidine. Clonidine, or Dixerit is the other name. It's a very good, it's a blood pressure drug, but it works very well for hot flushes. Another prescription medication is venlafaxine that helps. It's an antidepressant that helps for hot flushes. She didn't want medication. She didn't want prescription medication. She was comfortable using herbs. So what we gave her was black cohosh and ginseng. So you would use your ginseng first thing in the morning. It doesn't necessarily help with sleep, but it helps increase energy during the day, and then black cohosh at night. That worked very well for her hot flushes. The next thing we implemented for her was to get a cooling pillow. So there's not a specific brand that I like, but Sertra has a very good one. Tempur-Pedic has a very good one. You can just Google, look for something local. If we have people from far away looking at this, you don't have to, you can just look at wherever you are, a local brand, but there are cooling pillows specifically for menopause. And then I have all the herbs I mentioned in this book that we can use. There are some herbs that are not even legal in Canada, but then my patients, like, whenever they go on holiday somewhere, they get these herbs, they bring it back. You must just tell your doctor, then we just do your blood work, where we would maybe test your liver every 3 months, depending on the medication that you're using. But then there are herbs that really help with the hot flushes. Cooling pillow help. Next thing that helps is your pillow cover. So we love for our hair satin pillow covers. Satin pillow covers are good for your skin, but it's not good for menopause. So cotton bed sheets, cotton pillow cover. You'll have to have a conversation with your partner and say that even if you like to snuggle your whole life, during menopause is a time where you do not want to snuggle at night. Body heat won't be comfortable. You must have a look at your bed cover. We often have mattress covers that have plastic in the fabric that will make you more sweaty, so make sure that you don't have that. And some of my clients who really sweat quite a bit at night would have a towel under their bed, a dry set of a nightgown, an extra cotton nightgown next to their bed that they can quickly change into, so you don't even have to turn on the light. You can just quickly turn into a dry nightgown, sleep again. You can get quite good at this if you're very consciously planning it. Then, so that's quite important. Just your sleep environment should be cool. You can have a fan at your bedside, just not a fan overhead because your partner will be freezing, just really something on you to help you cool down when that hot flush comes. So treating your hot flushes would be critical for sleep. Next big thing for sleep is to journal at night. There's science behind that. I've never worked with a woman going through menopause who doesn't have an incredible amount of stress. Jane was very stressed. She's still in a very big senior position. She didn't quit her job. She's still in a very big senior position at our hospital. Most of women are at the top of their career when they go through menopause. So we typically then have career stress, we have children stress, where maybe your children might be going through their teenage years and have their own hormonal things that they're working through. We're often in the sandwich generation where we're looking after our parents, which is adding extra stress. So managing your stress is critical to get good quality sleep. Then when you get good quality sleep, you can go into your deeper sleeps, you will lose weight, you will have less irritability and brain fog the next day. It is okay. So let's get back to journaling. Why journaling is good? There's science that show that they've done a lot of studies that if you write down things before you go to bed, everything that you're worried about, everything that you're grateful for, it helps to get all of that on paper. And your brain now knows that your brain doesn't have to be stressed about that specific thing anymore because it's dealt with. And then your brain can let go. And then it's easier, because that's what most people say is they just have such a hard time to shut down. They just can't shut down. It feels like their brain is going. So that is something that you might find very helpful, is to journal, to have your bedtime routine, to have a bath with Epsom salts. That magnesium sulfate really helps to relax your muscles. You can have lavender tea. Lavender in your bathtub, chamomile tea is good. Lavender in your bath, or essential oils, lavender is helpful for sleep. Then to have that routine to go to bed every night at the same time, to make sure that you avoid screen time for 2 hours before bed. I find that's the trickiest. But when we're on our screens, this light emitted from our screens really keeps us awake. So that's quite a big thing. If you can really try your best to avoid screen time for the 2 hours before bedtime. And I know it's tricky. Many of my clients would work with blue light blocking glasses, and even watching TV, they found is a little bit better than being on your cell phone at night. What I started doing, and I recommend this to all my membership clients, is to leave their cell phone in the kitchen and to have a different clock in your room. Because what happens, a different clock, an old-fashioned alarm to wake you up first thing in the morning. Because what happens is, if you wake up 3 o'clock in the morning with a hot flush, then you just quickly look at your phone, what time it is, then you see a message, then you answer an email, and then you start scrolling, on social. These things all will keep you more awake, especially if you then think, oh, you might as well get up and get some work done. Then your brain gets used to the idea that, oh, okay, I can get productive work done at 3 o'clock in the morning that I don't do any other time. And then I find when people start doing this, to start getting work done, when they're in any case up, their body thinks, oh, this is a great time to work, and wake them up 3 o'clock in the morning to get all that work done. So I find that's quite critical, to force yourself to not allow yourself from 10 p.m. to 5 a.m. in that window to do your work. Night shift is a different ball game. So I'm not even going to delve into that. Then a lot of people ask me, is melatonin safe? Yes, melatonin is definitely safe during menopause. I advise 1 to 3 milligrams. It's difficult to get the 1 milligram here in Canada, so often 3 milligrams. For some of my clients, it does give them bad dreams, so just be aware that that is a risk. Then magnesium biglycinate is a very good supplement to help your muscles relax. It's a little bit different than the magnesium oxide, but it's a supplement that you can take at bedtime. It will help you relax to get a good sleep. So you can implement these things, and if you start implementing it tonight, you'll realize the incredible difference it makes in your quality of life. So what we did with Jane, we only focused on her sleep. Within a week, she implemented these things I told you now. Within a week, she was sleeping significantly better. She was happier. She was less frustrated with her work, with her husband. 6 months later, she lost the weight. So she gained, if I remember correctly, it was 15 pounds over the maybe a year or so that she's gained it. But then in less than 6 months, she lost her 15 pounds, and it's now 2 years later, and she's kept it off. Just by sleeping better. When you sleep better, you have less of that cortisol response. We have to eat more in the day. We have to eat more carbs when we're tired and overstressed. So fixing your sleep is critical, and it can be a complete game changer for you. I want you to have the same success that Jane Hay had. Menopause doesn't have to be hard. It can be an amazing phase in your life. You can have a good libido. You can have great sex. You might just need to implement other things. You might need lubrication, which you never needed before. Estrogen is something that really keeps your female area very plump. It's like a lush garden with estrogen, and as soon as there is less estrogen, it starts becoming thinner and less lush, and then you also don't secrete lubrication the way you used to. So women have to start using extra lubrication, and if you're just aware of that. And so I have in this book a specific topic covering sex and intimacy, and if you are aware that you can have an incredible intimate life when you go through menopause, you must just be aware that it's going to be different than in your 20s. I find that's the biggest thing for women. It's not women in their 50s. So we start with menopause. I should maybe start off by saying that. So the average woman go through menopause at the age of 52. Menopause is defined as that day 1 year after your last period. So when you go through your perimenopausal years, the time around menopause, and it's typically 10 years before your last period, and you can have symptoms up to 10 years after you've had your last period. So your perimenopausal years is a big period. It's 20 years. So say you very average, you go through menopause at 51, 52, then you might start having symptoms at 40, and these symptoms can continue till you're 60 years old. So we only know that you're postmenopausal that you're in menopause if you haven't had your period for a full year. Because at the end, your period might become irregular, and your period might become very heavy, and you might start going through the same changes that you started going through at the time when you started with your period. Maybe your period wasn't when you were 14, 15 regular from the get-go. You might have that same longer period, more heavy period when you go through menopause. And then, so it really, that's part of the reason why I'm so passionate about menopause. I would quite often see women in clinic, in family practice. I now only have a wellness clinic and I work in the hospital, but I used to have a very big family practice. And women would come to me with symptoms, and they would say they have severe anxiety, severe panic attacks, severe mood swings, palpitations, brain fog, and I would say, do you think you could be going through menopause? And they would say, oh no, absolutely not, I'm too young. And then later on, they would come with a different symptom and say, maybe I have difficulty concentrating, do you think I could have ADHD? And I would say, it's not impossible. I have some of my perimenopausal women here that I put on Concerta or drugs for concentration. It's not impossible, but do you think, you didn't come to me a year or two ago, you came to me now about your concentration, do you think it could be perimenopausal? And then women would say, no, I still have my period. And that is something that I want each one of you listening tonight to take home with you, is that you can be perimenopausal even if you still have your period. And you might benefit from hormone replacement therapy or all the other natural remedies that I have in this book for all the different symptoms that you might be going through. So it isn't just when you don't have your period anymore. You might still have your period, might have some perimenopausal symptoms, and you might benefit from managing those. You might, and that's really my goal for you, to have a significant better quality of life by implementing these things. So in the book, I go through all the different things that can help you, and I want to go with you through the table of contents. So how I made this book is I did it in such a way that you can read the book from front to back, but if you can't, you can also just look at, first I go through chapter 1, what is menopause? Just as I explained, what symptoms to look out for, what is it, to kind of think, am I going through it? Then the next one, because what often happens is people come to me and they ask me, can I test their hormones to see if they're going through menopause? We don't generally recommend that. We can, there's great tests that we can do. I can do blood work, we can do urine tests that you pee on little sticks, dry it, send it away to test for your different hormone levels at different times of the month. We can definitely do that, but our guidelines, the North American Menopause Society guidelines, Canadian Menopause Society guidelines, International Menopause Society guidelines, are to not treat a woman's menopause according to blood levels, but to treat it according to symptoms. So if your hormone levels, when I do blood work for you, is very, very low, but you have no symptoms, then you don't need to be treated. Unless we did an operation and took out your ovaries at a younger age, then, and so you had early menopause, then we have to give you estrogen to protect your heart, to protect your bone density. That's something else, and I cover that in the book as well. But just for the average woman, we don't treat hormone levels, we treat people. So if you come to me and you say, oh, you have symptoms, you want me to treat your menopause, and I do your blood work and it's perfect, but you have symptoms, I'm still going to treat it, even though your blood work looks perfect. So you don't really need blood work. There's other things that I often say you have to see your doctor for. You have to get a mammogram, you have to get a bone density scan, you have to test for type 2 diabetes, you have to test your cholesterol. You have to test your thyroid, because as your hormones fluctuate, you will find that it will impact all your other hormones. It will increase your risk for type 2 diabetes. Your risk of dying from a heart attack after menopause increases threefold. So that is quite critical to go to your doctor, but to check your cholesterol, to do an EKG of your heart, to see how much you're exercising, are you eating healthy? All the other pillars of health are so important. Then chapter 2 really talks about hormone therapy, to use hormone therapy or not to use hormone therapy. So my mom went through menopause when I was in med school in 2001, when there was all this research came out that hormone replacement therapy is bad for you, when the Women Health Initiative study came out, and everyone got very scared of using hormones. My mom was on hormone replacement therapy at the time. She was in a very demanding career. She was at the height of her career, and I told her she has to get off these hormones right away. And she didn't want to, because she felt that being on hormones gave her the edge to be competitive with other women at work who would be 20, 30 years younger than her. And she had a very hard time getting off these hormones. And then as she got off these hormones, that's really where my interest started, being so passionate with all the natural remedies for all the symptoms, because growing up in South Africa, we're more familiar with many herbs and traditional medicine. I feel people are often more comfortable using those than they would be here in Canada. And then also my mom was willing to try everything, because you can't give a big presentation at work and then suddenly have hot flashes and start sweating, right? So these things are very limiting to your career. If you don't sleep well at night, then you can't perform at your job the next day very well. So all of these things I find still, 20, 30 years later, impact my patients significantly. I have clients who would stop their job. They would quit their job because they would feel they can't focus, they're not good at their job, which is devastating, because it's really a time when you're supposed to go into leadership positions, when you have to excel at your career. So looking at the amount of women that leave the workforce when they're perimenopausal is absolutely devastating, and that's something that I'm a very big advocate for, and that I really want to journey with people, help them. And I'm jumping quite ahead, but I have a chapter on how to manage menopause at work. So that's quite important. So getting back to my mom, we tried all these different herbs and remedies, and from then I've always read up on everything I could and helped my patients with more natural strategies. So no, you don't have to go on hormone therapy. Some women do fantastically on hormone therapy. We now know that it's not as unsafe as we thought with the Women Health Initiative study. They tested hormones at women in a much older age, when they were not perimenopausal, when they were years postmenopausal. We have this hormone fluctuation because you would have high estrogen and suddenly nothing, and all your estrogen receptors are there waiting for the estrogen to come in, and there's nothing, and that's why you have these symptoms. As the time goes on, you tend to have less estrogen receptors, and that's why women typically at 80 years old, I recently had one in the hospital at 80 years old who still had significant menopause, but she was the only one. The average person, when they're older, don't have that perimenopausal symptoms, the hot flashes, because they had down regulation of their estrogen receptors. The only one thing that women do get, and when I admit women into the hospital, even if they're 90, 100 years old, who have bacteremia from urosepsis, so it means they're so sick they have to go to ICU from a bladder infection that spread to the whole body. that is really caused by the vaginal skin that thinned to such a degree as because of menopause, the vaginal, and you'll find everything in your body would be a little bit drier. Your eyes would be drier, your mouth might be drier, everything might be drier. But then the vaginal skin is significantly drier because of a lack of estrogen. Because of that lack of estrogen, you're at a higher risk of getting bladder infections. So if you do get bladder infections after menopause frequently, that would be an indication for estrogen vaginal cream. That estrogen vaginal cream doesn't really get absorbed into your body. That's different from the estrogen gel that we prescribe, a gel that you can apply to the arms. That gel get absorbed into your body. It bypasses the liver, so you're not at an increased risk for blood clots. That gel is great for systemic hormone replacement, but that's something different. Then we get a vaginal cream. So even if you don't have any other symptoms, you're 80 years old, you come to me in hospital because you're very sick from a bladder infection, then I would treat you with an estrogen vaginal cream. That cream doesn't really get absorbed into the rest of the body, but over time it makes the vaginal skin thicker. You're less likely to get bladder infections. That works fantastic. Okay, so the next one, and then in each chapter of this book, what I do is I discuss a specific patient's story. So I've had permission from these patients. If you recognize yourself in this book and I didn't get written permission from you to have your story in here, don't worry, it's not your story. It might just be very similar because so many women go through many similar things, and that's why I really felt the need to share their stories so that you know you're not alone. And if you feel alone in this journey, I really, really recommend that you join a group, find a menopause support group. And if you can't find anyone, I started one on Facebook. It's called Thrive Through Menopause. It's the same name as my book. And it's not a public group, it's a private group. So you have to ask a couple of questions before you answer questions before you go in. Because my goal is really to keep marketing away and to just have it for women to be able to connect with each other and to say, I'm going through this. How do we deal with this? I'm going through that. How do we deal with that? You know, a big thing is women find that they can't drink alcohol when they go through menopause anymore. Some women start getting hives. Some start getting sinus flare-ups. Women do not sleep well when they drink alcohol when you go through menopause. Even if you're used to drinking a glass of wine every night, suddenly when you go through menopause, you'll find things change. If you have any alcohol, you don't go into your deep sleeps. And then you might want to know from others, what do they do? What mocktails do they enjoy? Do you drink cranberry juice with sparkling water? What do you do at events? You know, so connect with other women. If you don't have women that you can share this journey with, go to Thrive Through Menopause, the Facebook group. I would love for you to be in our community. Then, so that's quite important to do this journey with other people. Then I talk specifically about mindful menopause. There's abundant science showing that being mindful, so your body is literally, your brain is rewiring itself. It is absolutely incredible as you go through menopause. So you're at this unique time in your life where you can really reinvent yourself. You can heal from childhood traumas. You can heal from unhealthy relationships. You're in the middle of your life. You can decide what you want your second half of your life to look like. You can decide where you want to be 50 years from now and how you're going to get there. And changes that you make now in your life will significantly impact how healthy you're going to be, how strong you're going to be, if you're going to have osteoporosis. And that's something that I talk about. Is movement in menopause is such a big thing. So we start breaking down muscle as we get older. And what I see with a lot of my perimenopausal patients is when they start gaining weight, they cut back on their calories. And because they cut back on their food trying to stay in shape, the body starts breaking down some of your own muscles. If you break down some of your own muscles, then your muscle mass gets less and your metabolism slows down. That increases your risk of everything. So say, God forbid, you come to hospital and I met you at 80 years old because of a hip fracture. if you have very, very strong muscles, you know, so that you can get up from a chair without holding at the hands, if you can just easily get up, because you've done all your squats, you have strong thigh muscles, then you'll get a hip operation after you broke your hip, and the next day you'll go home. If you have weak muscles, because you're a woman who tried to be skinny your whole life, then if you, God forbid, break your hip, because you're osteoporotic, because you didn't read my book and you didn't take extra vitamin D, extra calcium to protect your bone health, and you don't have muscles, those patients then tend to stay in hospital for 2 to 6 weeks to slowly strengthen, to be able to mobilize again before they can go home. And then you increase your risk of dying. That your risk of dying then that after that hip fracture would be 30% in that first year. You know, that's a significant mortality risk. So I really, really recommend movement in menopause. There are some studies that show that women move significantly less in menopause, obviously, because if you're not sleeping well and you're tired, you're going to move less. But then if you do move less, your risk of extra weight gain would be bigger. Nutrition is big. Nutrition is big to understand why you're gaining weight, how you have to eat different. To quickly go through it, everyone is different, but to realize that food is medicine. Even if you could get by looking fine on eating junk your whole life, you now have to eat for your mitochondrial health. Every cell in your body needs to be nourished. Things that nourish us would be protein, antioxidants, veggies and fruits, to get all your phytonutrients, antioxidants. So everything you put in your mouth, you must really, it's not about calories. So you can't say, oh, I'm having a chocolate, it's the same amount of calories as this food. As you go through menopause, you can't have a bagel or a muffin for breakfast anymore. You have to eat something with protein to keep your blood sugar balanced. You will be more insulin resistant, so you will need to stay away from sugars. You'll need to stay away from muffins and bagels. You'll have to eat proper whole foods, fruits, veggies, whole grains, and protein to really, really nourish your body. So that's quite important. Then I'm talking about stress and menopause. And I briefly mentioned it. I honestly haven't worked with a woman going through menopause that does not have a very high amount of stress. And stress on its own, because it releases cortisol, it lets you gain weight around your abdomen. And if you don't manage your stress, if you don't manage your cortisol levels, then you're not going to lose weight. You know, that is very important. You know, if you kind of take that home from tonight, you'll be good. If you just you have to manage your stress. There's different ways. I have YouTube videos that you can have a look at. If you just Google my name, Dr. Daniela Steyn, you'll see YouTube videos, and I can go down. You can maybe put a link for the YouTube in the chat. But there are videos on meditation, a non-religious way of meditation, things that you can do to just still your mind, breathing exercises you can do to really stimulate your vagus nerve. We have this nerve that innervates your diaphragm. When you do deep breathing exercises, you stimulate your vagus nerve. Stimulating your vagus nerve stimulates your parasympathetic system. If you stimulate your parasympathetic system, that really counters your sympathetic system, which is your stress system. Doing relaxation exercises every day religiously will make a significant impact in your quality of life. So really, to learn how to relax, I've had many years working on how to meditate, and I really find that what works best for me and many other people who are like me, type A and very driven, is to do a walking meditation, where you go for a walk and you just focus on your breathing rather than just sitting at home or getting annoyed by these ideas that run. If you want to delve into meditation, there's an app that I really like. I recommend it even for kids at the hospital. In the hospital, I work in all the different units, but I work in our mental health unit for kids as well. And this app is called Hoopla. No, sorry, not Hoopla, that's the library one. Headspace. And then Headspace has meditation for kids in a very simple, non-religious way. It helps you to understand what meditation is and how to really slow your thoughts. That's very helpful. Next thing that's very helpful is cognitive behavioral therapy, CBT. So there are not many doctors trained in CBT. There are not many health coaches in CBT, but you can Google it. You can look at my website. You can look in the book in chapter 8. I have a whole chapter on how cognitive behavioral therapy has science behind it, showing that it is helpful, very helpful in menopause. So what CBT or cognitive behavioral therapy is, so we used to, in therapy, go to a psychiatrist or a counselor and talk about your problems every week. Your husband is horrible, your parents were horrible, your work is horrible, and then life is horrible. CBT has a little bit of a shift. It acknowledges that you've been through a very difficult situation, but then it doesn't stay there. It says, okay, well, where do you want to go? So you really focus on your goal, and then it helps you to visualize that goal. And maybe you are feeling miserable now. Maybe you did gain a lot of weight. Maybe sex is painful at the moment, but then you look at where do you want to be and how are you going to get there? And then you really focus. It's very goal orientated. It's usually just 12 sessions. And every session you look at things, which thoughts are helpful to you and which thoughts are harmful. You go step through step. You identify that, are you making your own life harder with limiting beliefs? What are you implementing every day? It helps you take ownership of what's happening in your mind and in your body. CBT is very helpful. I have a whole chapter on sleep in menopause, and I discuss that with you now. That might be a game changer for you. Even if you're not perimenopausal, if you sleep better, life will be better. So that's important. Then I have a chapter on sex and menopause. You can have great sex during menopause, after menopause, until a very, very, very old age. Women can have sex longer than men. So it is really something that, to know that, there's tips of things that you can do. We talked about lubrication. We talked about getting the vaginal skin a little thicker, a little bit more plump. You have to see a pelvic physiotherapist. You can email me if you want local recommendations. I refer a lot of people locally, but you can just Google someone close to you. Our email address, I think, is there. It's info@wellnessmdhealth.com. Talking about email, I would love for all of you to subscribe to my newsletter. So I send out a newsletter, and it's on my website, wellnessmdhealth.com. I send out a newsletter every second Friday. And then on that newsletter, I would have little things like I'm sharing with you now, things that I do with my clients in my wellness clinic that I want to share with the world. So the wellness clinic is a very high-end 4 seasons concierge medicine experience where every client or member, it's on an ongoing membership. Everyone has a health coach, a nutritionist. But I don't want just this few people that I'm able to see to have this incredible experience. I really want everyone to have access to this tremendous success that we're seeing here in this clinic. And I want you to have that for free. So really look at the resources on my website. Really, you know what? If you type in your email address on the chat, we can send you a free menopause, it's like a menopause booklet that we can email you with just resources, how to have an amazing time through menopause. So yes, we'll email that to you. But there's on my website, YouTube, podcast, I have a lot of free resources, things that can really elevate your health, help you go to the next level. So I talk about sex and getting back to the pelvic physiotherapist. If sex is uncomfortable, most likely because of thin vaginal skin, but as women get older, even if you didn't have kids, most women would start having prolapse of the uterus, of the rectum. So what a pelvic physiotherapist do is she actually does an internal vaginal exam, but she does it much better than me as a doctor can do it. because they're specifically trained to look at all the different muscle groups in there, and they'll give you exercises. Kegel exercises is an example. I know a lot of you are familiar with Kegel exercises. But for example, if you do Kegel exercises, that can really help. A lot of people need a bladder lift, you know what? And your pelvic physiotherapist will be able to tell you, even if you don't have benefits, even if you have to fork out that cash for a once-off assessment, if she tells you you need a bladder lift, you need a referral to a gynae to get an operation to just lift that bladder, it might make a tremendous difference. For some people who just have, women who have just a little bit urinary incontinence, they find it's helpful to do Kegel exercises, definitely. Strengthening your core. There's a lot of things that can improve your sex, but then also the next chapter for bladder infections. Same thing. If you have bladder prolapse and every time you urinate, some urine stays behind, that urine that stays behind will grow bacteria. And I'm talking about that in my book as well, what to do for you to ice. Cranberry juice does work because it changes the pH of your bladder wall so that bacteria doesn't attach that easily. But then because your skin is thinner, every time you wipe, bacteria can get into the bladder easier. You can get bacterial infections easier. So that is really something that might be a game changer for you if you get that sorted. Then chapter 12 is about thrive through menopause at work. And that's what I want for each one of you. It's devastating when I hear about women who didn't go for that job that they knew they could have gotten, or that position, or who even try to cut back at work or stop working because they're having a hard time through menopause. If you want to stop working anytime, but don't let menopause be the reason why you stop working. Get help for your menopause. So then when I go, this was the first half of the book. The second half is talking about all the natural remedies that has science behind it. I did further training in functional medicine. I'm very well versed with herbs, which are allowed in Canada, which are safe. And I talk through all of them, the non-hormonal remedies, nutrition and lifestyle changes that you can do. So even if you don't want to read through a whole book, if you have one symptom, say your symptom is allergies, you never struggled with allergies before. Now suddenly at 42, you start struggling with allergies. You still have your period, but you listen to my talk and you think maybe you're getting closer to your menopause. This might be perimenopausal, might be excess histamine release. There's strategies how to manage with allergies, how to manage anxiety, bladder control issues. If you have urinary incontinence, if you cough or sneeze or jump or jog, and you, I have a great story in here from a fellow athlete that I did triathlon with, who had urinary incontinence, and we did triathlon hardcore. I had the opportunity to compete for Canada at the Triathlon World Championships 3 years ago. And she had significant urinary incontinence symptoms, and it's not fun to run. And a lot of women stop running as they go through perimenopausal years. I don't want that to be you. There is an answer. You can fix this. You're going to be happy the next 50 years of your life if you treated your urinary incontinence now. Bloating is something, gut health is something that becomes such a big concern during menopause, things that you can treat. Bloating, body odor changes, brittle nails, irregular heartbeat, itchy skin, mood changes. We're out of time. I spoke so much. I'm very, very, very passionate about this topic. I can literally talk for hours and hours and hours. Thank you so much for listening. I'm going to look at my screen here if I can see any questions, and I will answer your questions. Let me have a look. Let's see, this one is there. Chat. Ooh, there's a lot. Oh, thank you for sharing all that information.